Your feet might be sending warning signs of diabetes right now and you don't even realize it. From numbness to strange skin changes, these symptoms often appear early but are dangerously ignored. In the next few seconds, discover 9 critical signs you should never overlook. Most people believe that diabetes can only be caught by a blood test. You go to your doctor, the lab work comes back, and that's when you find out. I understand why people think that. For years, that's what most patients told me too. My name is Dr. Harrington, and I've been practicing medicine for over 20 years. And what I've learned, what I see confirmed in my office every single week, is that your body starts warning you about high blood sugar long before any lab result ever would. And the very first place your body speaks up, your feet. The reason I'm making this video today is because of how many patients I've seen walk into my office, or worse, walk into an emergency room who had every warning sign for months, sometimes years, and never knew what they were looking at. Today, I'm going to change that for you. Just last month, I sat down with a patient, a 67-year-old man, retired, healthy lifestyle, felt fine. He came in for a routine checkup, but before we did any blood work, I asked him about his feet. He told me, "My feet have been a little numb for a while." I figured it was just age. He had 4 of the 9 signs I'm going to show you today. His fasting blood sugar came back at 214. He was diabetic and had been for over 2 years without knowing it. So today I want to show you exactly what I showed that patient. 9 signs that were already on his feet and on millions of feet right now that almost nobody recognizes for what they are. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people walking around right now with a silent condition quietly damaging their nerves, their kidneys, their vision, and yes, their feet. The good news, a $12 blood test can catch this early. But first, you need to know what to look for. So let's get into it. Sign number 1 is something nearly every patient has already dealt with, and without exception, every one of them has rationalized it away. That prickling sensation, the loss of feeling, the pins and needles effect in the feet. My patients nearly always say, "Doc, my foot just goes to sleep occasionally. I had my legs crossed too long." And sure, that's perfectly normal from time to time, but I always follow up with this question, is it recurring without any obvious cause? Because if the answer is yes, we need to have a different conversation entirely. Persistent, recurring loss of sensation or tingling in the feet, what the medical community calls peripheral neuropathy, ranks among the earliest indicators that blood glucose has been running high for an extended period. The excess sugar circulating in your bloodstream gradually erodes the protective sheath surrounding your nerve fibers. It's an incremental process, which is precisely why the vast majority of people overlook it completely. I explain it to my patients using this comparison. Picture your nerves as electrical cables. Each cable has an insulating jacket that keeps the signal traveling cleanly from your brain down to your toes. When blood sugar remains chronically elevated, it functions like a corrosive agent, slowly dissolving that insulation. The cable still transmits for a while, but the signal becomes distorted and unreliable. That distortion is the tingling you're experiencing. Data from the American Diabetes Association indicates that peripheral neuropathy impacts close to half of all individuals living with diabetes. It stands as the single most prevalent complication, and it virtually always manifests first in the feet. That means right now, tens of millions of Americans are feeling this tingling and dismissing it as inconsequential. Don't make that mistake. My standard recommendation for every patient past 60, commit to a 20 to 30-minute daily walk. Not running, not jogging, walking. Consistent movement is the most effective way to maintain circulation to your extremities and safeguard those nerve endings. And begin cutting added sugar from your meals today. Not eventually, today. Sign number 2, and patients consistently describe this one as the most unsettling of all, because it doesn't manifest during waking hours when you're busy and distracted. It arrives at night when you're lying in bed trying to fall asleep and there's nothing to take your mind off it. Many of my patients attribute this to spending too many hours on their feet, or the heat, or simple exhaustion. And sometimes those explanations are perfectly valid. But when someone tells me their soles feel like they're being held against a hot surface, especially once they lie down at night, that gets my full attention immediately. An intense burning sensation concentrated in the soles, particularly after dark, is a hallmark early presentation of diabetic nerve damage. Here's the mechanism. The nerves in your feet have sustained injury from prolonged sugar exposure and are now transmitting garbled signals to your brain. Your brain receives a message that reads extreme heat, even though nothing warm is anywhere near your foot. The nerves are malfunctioning. Consider a smoke detector with a cracked sensor. There's no smoke, no fire, but the alarm keeps sounding because the detection mechanism itself is broken. Your peripheral nervous system is doing exactly the same thing. The burning you feel doesn't originate from an external source. It's generated internally by compromised nerve tissue that's signaling distress. Published findings in the journal Diabetes Care confirm that burning foot pain ranks among the first symptoms reported by patients who are subsequently diagnosed with type 2 diabetes, frequently emerging 1 to 3 years ahead of any formal diagnosis. 2 practical habits for this one. First, ensure you're consuming at least 8 full glasses of water daily. Adequate hydration supports your kidneys in clearing excess glucose and helps maintain nerve tissue integrity. Second, incorporate more dietary fiber into every meal. Vegetables, beans, lentils, whole oats. Fiber decelerates glucose absorption into your bloodstream, which is exactly the relief those damaged nerves require. Sign number 3, and I need your complete attention here because this is where the situation transitions from uncomfortable to genuinely perilous. This is the sign responsible for the most emergency room visits among my patients. They arrive and tell me, "Dr. Harrington, I had a small blister from a new shoe about 3 weeks ago. It still hasn't closed up." They waited. They assumed the body would take care of it on its own. And normally, minor wounds do resolve independently, but not when glucose levels are running high. When blood sugar remains persistently elevated, your body's repair mechanisms become severely impaired. The blood vessels distributed throughout your body, including the microscopic ones servicing your feet, progressively narrow and lose elasticity. The consequence is that oxygen, immune cells, and the nutrients essential for tissue reconstruction simply cannot reach the wound site with adequate speed. The wound remains open, exposed, and painfully slow to seal. I describe it to patients this way. Imagine trying to irrigate a garden through a hose that's been severely pinched. The water supply exists, but it can't reach the plants. That's precisely what chronically high blood sugar does to the microcirculation in your feet. Every ingredient needed for healing is present in your blood. It simply cannot arrive at the destination. And an open wound that refuses to close is essentially an engraved invitation for infection. The Centers for Disease Control documents that diabetic foot ulcers represent the primary cause of non-traumatic lower limb amputations across the United States, exceeding 100,000 annually. Virtually every single case was preceded by a minor wound that went unaddressed. Tonight, after your bath or shower, take a seat and examine both feet thoroughly. Inspect between every toe. Check your heels and soles carefully. If you identify any cut, blister, or area of broken skin, clean it gently with mild soap and water. Apply antiseptic and cover it properly. And if there's no visible improvement within 48 hours, contact your doctor. Not sometime next week, within 48 hours. Sign number 4, and this one is concealed right in front of you. Most people encounter it every single day without recognizing what they're observing. It's completely visible. It's been developing for a while, and virtually nobody links it to blood glucose. Patients notice their feet taking on a darker or more reddish hue and tell me, "I assumed it was just sun exposure," or "the skin around my ankles has always been a bit darker." And sometimes that's an accurate assessment. But there's a distinct pattern of discoloration concentrated around the ankle region that I specifically evaluate when screening for blood sugar concerns. When circulation becomes compromised due to elevated glucose, the lower legs and feet receive insufficient quantities of fresh, oxygenated blood. The skin responds with visible color changes. You might observe darkening, deep reddening, or even a bluish-purple cast around the ankles. This is your skin communicating that blood delivery to that area has become inadequate. In certain patients, the skin simultaneously becomes noticeably thinner and more fragile in those regions. Another indication that the tissue is being starved of proper nourishment. Here's how I frame it for my patients. Consider your blood as a delivery vehicle transporting oxygen and essential nutrients. Your feet sit at the terminus of the longest supply route in your entire body, further from your heart than any other structure. When the pathways constrict because of vascular damage, deliveries start falling behind schedule. The skin, deprived of adequate oxygen supply, begins changing color. It's a visible distress beacon you can detect with your own eyes, provided you understand what you're examining. Research published in the Journal of the American Academy of Dermatology established that these dermatological changes become detectable on average 18 months prior to a formal diabetes diagnosis. The daily practice here: dedicate 5 minutes each morning to ankle rotations, toe raises, and calf stretches. Even that modest investment in movement drives blood circulation into your feet. And if mobility is limited, simply elevating your feet slightly while seated can produce a meaningful difference in perfusion. Sign number 5, and this one generates the most surprise among my patients because it appears entirely benign. In fact, most people have been dealing with it for years without ever once associating it with blood sugar. "Dr. Harrington, my heels crack every winter. It's nothing more than dry skin." I hear that statement constantly. And absolutely, that's an extremely common condition. But when your heels are splitting badly in the middle of July, or when no moisturizer provides lasting relief regardless of how liberally you apply it, that's a fundamentally different situation. Diabetes damages the autonomic nerves, the ones responsible for regulating automatic bodily functions you never consciously think about. One of those functions is controlling moisture production and perspiration in the skin. When these nerves sustain damage, the sweat glands in your feet cease operating correctly. Your feet lose their natural moisture from within. No topical product addresses the underlying cause. Visualize your skin as a masonry wall that needs to remain sealed and intact. When autonomic nerve damage occurs, the mortar binding the bricks begins deteriorating. Fissures develop. And those cracks in the skin of your feet are far more than cosmetic concerns. They represent open portals for bacteria and pathogens. In a foot already suffering from reduced circulation, that resulting infection can escalate to something very serious very rapidly. I've treated patients with heel fissures so deep they were actively bleeding, and they informed me they'd been applying lotion faithfully for 2 years without any improvement. That's not a dermatological issue, that's a neurological one. The American Podiatric Medical Association classifies chronic treatment-resistant heel fissuring as a significant marker of autonomic neuropathy in older adults, a condition with direct ties to prolonged elevated blood glucose. And autonomic neuropathy is far from a minor annoyance. It signals that the nervous system is under substantial systemic stress. Apply moisturizer to your feet every single evening before bed. A quality lotion or pure coconut oil both work effectively. Concentrate on the sole and heel area thoroughly. However, never apply moisturizer between your toes. Trapped moisture in those spaces cultivates fungal infection. And maintain your 8 glasses of water daily. Your skin requires hydration from the inside just as much as from the outside. I want to pause here for a moment. We've covered 5 signs so far, and I want to ask you something directly. Have you noticed any of these signs in yourself or in someone you love? A spouse, a parent, a sibling? If the answer is yes, even one sign, go to the comment section right now and type the word yes. Just yes. Capital letters. That's all I need. I read every single comment on this channel. Everyone. If you have a question, ask it. If you're concerned, tell me. That's why I created this channel. Not to talk at you, but to talk with you. And if you're finding this useful, hit the like button right now. It takes 1 second and it tells YouTube to show this to more seniors who need it. All right, let's keep going. Sign number 6. And this one carries more weight than most people appreciate because it's not exclusively about your feet. It's reflecting what's simultaneously happening to your kidneys. Nearly everyone presenting with this symptom tells me, I'm at a desk all day or I'm on my feet for work 8 hours straight. Occasional swelling related to prolonged activity is completely normal. I want to be transparent about that. But if your feet and ankles are persistently puffy and you're finding deep indentations from your socks every single evening, the clinical picture shifts significantly. Chronically elevated blood sugar takes a toll on kidney function. Your kidneys are the master regulators of fluid equilibrium throughout your body. When kidney performance deteriorates under years of excessive glucose exposure, fluid begins accumulating in the lowest points of your anatomy, your feet and ankles. This swelling, medically termed edema, signals that your body's internal filtration infrastructure is under duress. Picture your kidneys as the water treatment facility for your entire system. Every unit of blood cycles through them for purification. When elevated sugar compromises those filters over time, the system experiences backlog. Excess fluid has nowhere to drain except downward. Gravity handles the rest. The fluid settles into your ankles and feet. You press a finger into the swollen tissue and the depression lingers for several seconds. That's called pitting edema, and it warrants serious attention. The National Kidney Foundation reports that diabetic nephropathy affects roughly 1 in 3 adults living with diabetes, and lower extremity edema frequently serves as the initial visible evidence that kidney function is deteriorating. During rest periods, position your feet above heart level. Even a few inches propped on a pillow makes a difference. This assists in redistributing accumulated fluid back toward your body's core. Additionally, cut back on dietary sodium. Salt drives water retention, which amplifies edema considerably. Check nutrition labels carefully. Many canned goods and processed foods contain surprisingly high sodium levels. And if the swelling is recent in onset, persistent, or progressively worsening, please raise it with your physician at your next appointment. Don't allow it to escalate into a larger problem. Sign number 7 is the one I encounter most frequently being misattributed, men in particular. And by the time the true cause is identified, they've been enduring it and suppressing it for years. The majority of my senior patients are male, and what I hear almost universally is this. I've been popping ibuprofen for this foot pain for months. Figured it was arthritis or maybe an old injury acting up. I've encountered this narrative dozens of times, and occasionally that assessment is spot on. But sometimes the pain originates from an entirely different source, one that no anti-inflammatory medication will ever address. When nerves sustain chronic damage from prolonged high blood sugar, they don't always fall silent. In many cases, they become overactive. Rather than going numb, they begin generating spontaneous, intense impulses that your brain registers as acute pain. Patients characterize it as stabbing, like an electric jolt, or as though a heated needle is being driven through the foot. This occurs most frequently at night when competing sensory input is minimal. Think of a vehicle alarm that got jarred in a collision. Every few minutes it blares without provocation. Nobody is attempting to break in. The alarm mechanism itself is simply damaged. That's exactly what a compromised nerve does. It broadcasts emergency signals to your brain when absolutely nothing is occurring. The pain experience is entirely real, but its origin is neural dysfunction, not physical injury. And consuming ibuprofen doesn't repair a damaged nerve fiber. What it accomplishes is masking a signal your body is urgently trying to communicate. And silencing signals is precisely the opposite of what you want when your nervous system is requesting intervention. A major study published in the New England Journal of Medicine determined that painful diabetic neuropathy impacts approximately 1/4 of all diabetes patients and is routinely misidentified as arthritis, tendinitis, or age-related joint deterioration. Each morning, invest 5 minutes in gentle foot and ankle mobilization before leaving your bed. Flex your feet deliberately. Rotate your ankles in both directions. Draw your toes back with a gentle stretch. Establish circulation before placing any load on your feet. And each evening before sleep, perform a gentle 3-minute foot massage. Light circular motions along the sole and ascending up the ankle. Your nerve tissue will benefit considerably. Sign number 8 is the one that reveals to me how far the condition has advanced. When this presents in a patient, I recognize that the damage is no longer in its early stages. And almost without fail, the patient's initial response is, "Doctor, that's been the case my entire life." They say, "I've always had cold feet, Dr. Harrington. My spouse has monopolized the heated blanket every winter for 3 decades." And I share a laugh with them. But then I press further. Are your feet cold in the middle of July? Are they cold underneath multiple layers of blankets? Because that's the point at which genuine concern sets in. Feet that remain persistently cold irrespective of ambient temperature. Cold during summer months, cold beneath heavy bedding, cold even when the rest of your body registers warmth, represent a strong indicator of substantially compromised arterial circulation in the lower extremities. Your blood vessels have constricted or calcified to a degree where warm, oxygenated blood simply isn't reaching the tips of your feet in adequate volume. Imagine your vascular system as a central heating network running pipes to every room in a building. When those pipes become narrowed from glucose-mediated damage, the warmth fails to reach the far rooms. Those rooms stay cold regardless of how aggressively the boiler operates. That persistent chill isn't about the weather outside. It's about the condition of the pipes. The American Heart Association identifies peripheral artery disease, caused by progressive vessel narrowing, as affecting over 8 million Americans, with diabetes standing as the single most significant contributing risk factor. Persistently cold feet rank among its earliest and most reliable presentations. The most effective countermeasure here is a daily 30-minute purposeful walk. Not a leisurely stroll, a deliberate arm-swinging, pace-driven walk. This propels blood circulation deep into the feet and lower legs, reinforces vascular wall integrity, and over time can partially reverse early-stage narrowing. Begin with 10 minutes if half an hour feels excessive. What matters most is initiating the habit today. Sign number 9, and this is the one that virtually nobody ever discusses. The one I've never encountered in a patient information pamphlet. The one most people walk right past, including a fair number of physicians. But once you're aware of it, you will never fail to notice it again. And I rarely need to raise it directly because patients themselves almost never register it. But during a clinical foot examination, when I inspect the lower legs and the dorsal surface of the feet, occasionally there's a conspicuous absence of hair in those regions. The patient glances down and says, I'd never noticed that before." And that is exactly the problem. It's a subtle finding, easily missed, but it carries significant clinical weight. Hair follicles require a consistent delivery of blood and oxygen to remain functional. When circulation becomes meaningfully impaired by long-standing glucose elevation, the follicles across your feet and lower legs progressively lose access to what they need. Over time, they cease producing hair altogether. That hair loss serves as a visible biological marker of vascular damage that has been developing in many instances across multiple years. Think of hair follicles as small plants arranged in a garden bed. When the irrigation line feeding them narrows or becomes obstructed, the plants don't perish overnight. They simply stop growing one by one. That absence of growth is your body transmitting a message about the state of your vascular health. A message you can observe every time you look at your lower legs. Research published in Diabetes, Obesity, and Metabolism confirmed that hair loss on the lower extremities correlates significantly with peripheral vascular disease among diabetic patients. It remains a reliable and consistently under-recognized sign that clinicians are specifically trained to assess. Immediately after this video, examine your lower legs and the tops of your feet. If the hair coverage is noticeably sparser than what you see on the rest of your leg, or if it's absent entirely, schedule a blood glucose screening this week. Not sometime this month, this week. Approximately $12 at any certified laboratory and covered under Medicare for most of you. $12 can fundamentally alter the course of your health. We've covered a lot today. 9 signs, 9 opportunities to identify something before it identifies you. And I want to be straightforward with you about something. One of the most difficult aspects of my work is sitting across from a patient who has exhibited every single one of these signs for 2 years and is only now learning the explanation. Not because they were careless, they cared profoundly. They simply lacked the information. You now possess that information, and I want you to act on it in one specific way. Just one. Tonight, before you go to bed, sit down and look at your feet. Take 30 seconds. Look at the skin, look between the toes. Feel for numbness. Check for any wound that shouldn't be there. 30 seconds. That's all I'm asking. And if you see or feel anything on this list, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier you catch this, the more completely it can be managed in most cases through a change in diet, a daily walk, and a conversation with your doctor. You worked hard for the life you have, for your independence, your health, your ability to do what you love. Don't let something as manageable as blood sugar take any of that from you just because nobody told you what to look for. Now you know, if you found this useful, share this video on Facebook right now. Tag someone you care about and a family member, a friend, a neighbor. You might be giving them something they didn't know they needed. And if you want more conversations like this one, I post a new video every week on this channel. Topics that matter for your health after 60. Things I talk about with my patients that most people never hear outside a doctor's office. Subscribe and bring someone you love along with you. I'm Dr. Cole Harrington. Stay aware, stay proactive, and take care of those feet. I'll see you next week.